If you wake up with a dry mouth every morning, your body is warning you about this. Waking up every morning with a dry, uncomfortable mouth may seem like a small inconvenience, but for those over 50, it can be a quiet signal your body is trying to get your attention. It's not just about thirst, it can point to deeper issues affecting your sleep, hydration, and even vital organs. Many ignore it, thinking it's normal with age. But what if this daily discomfort is actually a warning sign? Something your body is gently trying to tell you before it becomes a bigger problem. Understanding this early could protect your health in ways you never expected. If you care about your health and want simple, natural ways to feel better every day, take a moment to subscribe to this channel. Like this video and share your experience in the comments. Your story might help someone else who is silently dealing with the same issue. Dehydration is one of the most common reasons for waking up with a dry mouth. During sleep, the body continues to lose fluids through breathing and normal metabolic processes, and if enough water is not consumed during the day, the mouth can feel uncomfortably dry by morning. For adults over 50, this becomes more noticeable because the natural sense of thirst gradually declines with age. Some doctors explain that this reduced thirst response often leads to chronic mild dehydration, even when a person does not feel particularly thirsty. Over time, this lack of hydration can affect important body functions, including digestion, where saliva plays a key role in breaking down food. It can also place extra strain on the kidneys, which rely on adequate fluid levels to filter waste efficiently. A consistently dry mouth may also impact concentration and mental clarity, as proper hydration supports healthy brain function. Research suggests that even mild dehydration can lead to fatigue and reduced alertness, which can affect daily activities in subtle but meaningful ways. Increasing water intake throughout the day is one of the simplest and most effective ways to support saliva production and restore balance in the body. Sipping water regularly, rather than waiting until feeling very thirsty, helps maintain moisture levels in the mouth. Many healthcare professionals recommend paying attention to urine color as a simple sign of hydration, aiming for a light yellow shade. Addressing dehydration early can ease morning dryness and support overall health in a gentle but important way. Staying properly hydrated also supports joint comfort and circulation, which become increasingly important with age. Small habits, like keeping water nearby and drinking after waking, can make a steady difference. When the body receives enough fluids, saliva production improves, and the discomfort of dry mouth often begins to fade. Mouth breathing during sleep is a common cause of waking up with a dry mouth, especially when the lips remain open for long periods overnight. When air passes directly through the mouth instead of the nose, it dries out the protective layer of saliva that keeps oral tissues moist and healthy. This loss of moisture can leave the mouth feeling sticky, irritated, and uncomfortable by morning. Some doctors explain that nasal breathing naturally filters and humidifies the air, helping maintain a balanced environment inside the mouth and throat. When breathing shifts to the mouth, this natural process is bypassed, leading to dryness and increased exposure to bacteria. Over time, reduced saliva can weaken the mouth's defense system, making it easier for harmful bacteria to grow. This can gradually contribute to gum inflammation, tooth decay, and persistent bad breath. Research has shown that individuals who regularly breathe through their mouth during sleep may have a higher risk of developing periodontal problems. For adults over 50, this becomes more concerning because the body's ability to repair and protect oral tissues is already slower compared to younger years. Mouth breathing is often linked to nasal congestion, sinus issues, or long-standing habits that go unnoticed. Some doctors warn that it may also affect sleep quality, as it can lead to lighter, less restorative sleep patterns. Poor sleep can further impact energy levels, memory, and overall well-being. Avoiding the habit of sleeping with an open mouth and addressing underlying causes can help restore natural moisture levels. When breathing returns to the nose, saliva is better preserved, and the mouth remains more comfortable through the night, reducing dryness and supporting long-term oral health. Side effects of medications are a frequent and often overlooked cause of waking up with a dry mouth, particularly in adults over 50 who may be taking multiple prescriptions. Many commonly used drugs for conditions such as high blood pressure, allergies, anxiety, or depression can reduce saliva production as part of their normal effect on the body. This reduction may not seem serious at first, but it can quietly affect oral comfort and health over time. Some doctors warn that medications like antihistamines, Diuretics and certain antidepressants interfere with the signals that stimulate salivary glands. As a result, the mouth produces less saliva, especially during sleep when production is already naturally lower. This can lead to noticeable dryness by morning. Along with a sticky or burning sensation in the mouth, saliva plays a critical protective role by washing away food particles, neutralizing acids, and controlling bacterial growth. When saliva levels drop, the mouth becomes more vulnerable to tooth decay, gum disease, and oral infections. Research has shown that reduced saliva flow increases the risk of cavities, particularly near the gum line, which can be harder to detect and treat for older adults. This effect is more significant because the body may already produce less saliva with age. When combined with medication use, the impact can become more pronounced. Some healthcare professionals advise paying attention to persistent dry mouth as a possible medication-related issue rather than dismissing it as a minor inconvenience. Ignoring this side effect can allow oral health problems to develop gradually. Recognizing the connection between medications and dry mouth is an important step in protecting long-term dental health and maintaining comfort. During daily life and sleep, persistent dry mouth can be an early warning sign of elevated blood sugar levels, a condition commonly associated with diabetes. When glucose builds up in the bloodstream, the body attempts to remove the excess through increased urination. This process draws fluids out of the body, leading to dehydration, which often shows up as dryness in the mouth, especially after several hours of sleep. Some doctors explain that this type of dryness is not just a minor discomfort, but a signal that the body's internal balance may be under strain. As fluid levels drop, saliva production decreases, leaving the mouth feeling parched and sometimes sticky or irritated. Over time, this can affect the health of the gums and teeth, as saliva is essential for maintaining a clean and protective environment inside the mouth. Research has shown that people with uncontrolled blood sugar levels are more likely to experience oral health issues, including infections and delayed healing. For adults over 50, this becomes more concerning because both the risk of diabetes and the body's sensitivity to dehydration increase with age. A consistently dry mouth in the morning may be one of the subtle signs that something deeper needs attention. Some healthcare professionals advise monitoring blood sugar levels regularly if this symptom appears frequently. Early recognition allows for timely management, which can help prevent complications such as nerve damage, kidney problems, and vision issues. Paying attention to these small but persistent changes can make a meaningful difference. Addressing elevated blood sugar not only supports overall health, but also helps restore proper hydration levels in the body. When blood sugar is better controlled, fluid balance improves, and saliva production often returns to a more normal level, easing the discomfort of dry mouth over time. Caffeine and alcohol consumption, especially in the evening, can play a direct role in waking up with a dry mouth. Both substances have a dehydrating effect on the body, which can reduce the amount of saliva produced during the night. When saliva levels drop, the mouth loses its natural moisture and protection, leading to a dry and uncomfortable feeling by morning. Some doctors explain that caffeine, commonly found in tea, coffee, and certain soft drinks, acts as a mild diuretic. This means it encourages the body to lose more fluid through urination. When consumed later in the day, it can quietly reduce overall hydration levels before sleep even begins. As a result, the body enters the night already slightly dehydrated, making dry mouth more likely. Alcohol has a similar, but often stronger effect. Research suggests that alcohol not only dehydrates the body, but also directly affects the salivary glands, slowing down saliva production. During sleep, this effect becomes more noticeable, as the body is not taking in fluids to compensate for the loss. This can leave the mouth feeling dry, sticky, and sometimes irritated upon waking. For adults over 50, these effects can be more pronounced. The body's ability to retain fluids and maintain balance changes with age, making it more sensitive to dehydration. Some healthcare professionals warn that regular evening consumption of these beverages may also interfere with sleep quality, leading to lighter and less restorative rest. Avoiding or limiting caffeine and alcohol intake before bed helps the body maintain better hydration levels throughout the night. When fluid balance is preserved, saliva production remains more stable, reducing the chances of waking up with a dry mouth and supporting overall comfort and sleep health. Smoking use is a major cause of persistent dry mouth, especially when tobacco is used regularly over time. The heat and chemicals from smoke directly reduce saliva production and irritate the delicate tissues inside the mouth. As saliva decreases, the mouth loses its natural moisture, often leading to dryness that becomes more noticeable after a full night of sleep. Some doctors explain that tobacco affects the function of salivary glands, making them less efficient at producing the fluid needed to keep the mouth balanced and protected. Over time, this damage can become long-lasting, leaving the mouth feeling dry not only in the morning, but throughout the day as well. This dryness can also create a sticky sensation and discomfort while speaking or swallowing. Research has shown that reduced saliva caused by smoking increases the risk of gum disease, as bacteria are able to grow more easily in a dry environment. Without enough saliva to wash away harmful particles, the gums can become inflamed, and tooth decay may develop more quickly. In more serious cases, long-term tobacco use has been strongly linked to oral cancer, which can begin with subtle changes inside the mouth for adults over 50. These risks become more significant because the body's ability to heal and maintain oral health naturally slows down with age. Some healthcare professionals warn that continued tobacco use can worsen existing dental problems and delay recovery from minor infections or injuries in the mouth. Avoiding tobacco in any form allows the mouth to gradually regain some of its natural moisture and balance. As the effects of smoking lessen, saliva production may improve, reducing dryness and discomfort. This change can support better oral health and contribute to a greater sense of comfort and well-being over time. Aging-related changes can naturally lead to a dry mouth, especially during the early hours of the morning when the body has gone several hours without fluid intake. As the body grows older, many internal processes begin to slow down, including the activity of the salivary glands. This gradual decline means less saliva is produced, making the mouth more prone to dryness over time. Some doctors explain that saliva plays an essential role not only in keeping the mouth moist, but also in protecting teeth, supporting digestion, and maintaining a healthy balance of bacteria. When production decreases with age, these protective benefits are reduced. This can leave the mouth feeling dry, uncomfortable, and sometimes more sensitive than before. Research suggests that while mild dryness can be a normal part of aging, persistent or worsening symptoms should not be dismissed as something unavoidable. For adults over 50, ongoing dry mouth may increase the risk of oral health concerns, including gum irritation, tooth decay, and difficulty swallowing. These effects can gradually impact daily comfort and overall well-being if left unaddressed. Some healthcare professionals advise paying close attention to these subtle changes, as they may reflect the body's need for better support. Maintaining proper hydration helps compensate for reduced saliva production, allowing the mouth to stay more balanced. Adequate nutrition also plays a role in supporting gland function and overall health. Providing the body with consistent care can make a noticeable difference in how it adapts to aging. When hydration and nourishment are maintained, saliva production may improve slightly, and the discomfort of dryness can be reduced. This gentle support helps the body function more comfortably, even as natural changes continue with age. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.